I'd like to prepare you a little bit for what the study guides are all about. You'll have a PowerPoint version, and those will have some information within the PowerPoints, and I'll use those PowerPoints in order to do the video recordings, so that you have something to follow along with, and you can take notes, but you can go back and listen to those recordings as often as you need to. So I brought up a study guide over here for the abdominal vessels. And in the very beginning of the study guide, there are generally some terms that you need to be familiar with. You need to know not only what the abdominal aorta is, but where it's located and what are some of the surrounding structures. And then we'll have images that give you a little bit more information about where the various structures are in relationship to the other anatomy. And there'll be some images, sometimes from Bing or from Google Images. There'll be Netters, of course. There'll be eAnatomy. There'll be some images from slides that I've had over the years, or ones that Maria, the previous instructor, ones that she's had as well. And there'll be angio images, CT and MRI, of course, as well as other drawings and illustrations. And so each week there'll be one or more of these study guides depending on the anatomy that we're studying for the week, and then there'll be a corresponding audio recording with me pointing out the different structures as well. And it's something for you to get used to with these lectures is the style of speaking in sectional anatomy and being able to describe where the anatomy is using the terms superior, inferior, left and right, and anterior and posterior. And those will be described to you in the very first study guide that we go over to talk about anatomy and the different terminology that we use in order to describe anatomy. And then in terms of eAnatomy and Netters, again, those are over here in the left-hand menu, and I brought them up just to make it a little bit quicker. But for eAnatomy, you'll have all these different thumbnails of different areas in the body that you want to take a look at, and there'll be, again, illustrations or images. And just to show you one in particular, so we've got the abdomen pelvis. This is a CT scan. And not only will you get a set of images, generally in an axial plane, but you can sometimes switch between them depending on the part of the body that we're going over. But you'll be able to scroll through these, superior to inferior. So now we're coming into the liver here on the right, and the spleen on the left. This is anterior, this is posterior. So you have this image, but then you also have a reference line over here, and that's going to tell you where in the body that image is coming from. Not usually only in a sagittal, but also in a coronal, just depending on eAnatomy and how they set it up. So that's really very helpful for you to get an idea where in the body these structures are located. You also have these labels, and you're able to turn them on or off by going up to the top. Let me see if I can scroll up just a little bit for you. And go to anatomical parts. So you can either deselect all and use it maybe as a testing device for you so that you can quiz yourself, or you can turn on select all and you'll get vessels and organs and the bony anatomy. And then also there's hepatic segmentation, and this is available in some of the other anatomy as well. I think the brain might have this to show you the different lobes of the brain. But hepatic segmentation, I guess I didn't turn it on and off really quickly there, will color code the different hepatic segments so that you can see where they actually will begin and end within the liver. So that's also a nice feature of eAnatomy. And then I wanted to show you Netters. So when you bring up Netters, you'll have both the 5th and the 6th edition, and they're a little bit different. Each one's a little bit different. Oh, look, now you can buy the 7th version as well. Let me go back here for just a second. So let's go into the 5th. The 5th is set up a little bit differently than the 6th, in that the 5th has a list, a table of contents on the left, a table of contents list on the left. And you're able to just click on each section and get an idea of the different anatomy within that section to look at. And then you can bring that up and take a look. And you do need to orient yourself in Netters, because often they'll show an anterior and a posterior view, but they will only put that sometimes in a very small print, so you may not necessarily pick up right away that these are two different views. So here you have an anterior view, and then this one says posterior view here. Same thing with the liver, and I'm going to try to bring that up here in the 6th edition. So I'll show you the 6th edition because they're a little bit different. And this one on the 6th edition, you can actually just type in, maybe it's not going to let me go back. Okay, let me bring this up here. The 6th edition brings it up more as a search toolbar, so you're able to search rather than just looking at a table of contents. So if you enter a keyword up here, okay, type about liver, and then you'll have all the different images that include the liver. And there are often several pages. This is a good example of an image that's not always obvious right away that you're getting both an anterior and an inferior view. So this is the anterior surface of the liver. This is the right side of the patient, and the left superior and inferior. And you've got the round ligament coming off here and gallbladder here. And then they've basically taken this image and flipped it upside down so that you've got the underneath and posterior side surface of the liver here. You've got the gallbladder, and now that round ligament is pointing superiorly instead of inferiorly. So that's just a different view of the liver, but in the beginning it's not always obvious, and then it says visceral surface underneath it. So just be sure to orient yourself when looking at the images, just so that you don't get confused, because the anatomy can be quite confusing in the beginning. And see, I want to also tell you about most of the scans that you're going to find and most of the images within Netters are normal images, and so it's a good idea if you have a PACS system that you're able to look at to get some images of abnormal anatomy. It's just helpful to be able to see how things can shift and move and be not in the same place that you're expecting them because of a tumor or because of some sort of a vessel abnormality. So if you get a chance, please look through some abnormal anatomy at your place of work as well. And if you have any questions, please let me know, and I'm always happy to do a Zoom conference or a phone call if you're ever confused on anatomy. Thanks.